Here are 3 things to know about how pharmacists prepare kits for medical assistance in dying, also known as MAiD. First, the patient may choose to take the medications by mouth or have a physician or nurse practitioner administer the medications by IV. It may occur at a patient's home, hospice, or hospital. Typically, the kit will be picked up by the physician or nurse practitioner, or the pharmacist will deliver or dispense it to the patient. Second, 2 complete kits are usually dispensed, each kit containing all the medications needed for the MAiD process. The protocol may require the kit to include pre-filled syringes or vials that need to be drawn up. The kits must be dispensed in sealed, tamper-proof containers. And third, there must be a plan for disposing of unused medications after the MAiD process is complete. The kit and unused medications should always be returned to the pharmacy. In the community, all unused medications are disposed of, and in hospitals, unopened vials can be used for another MAiD kit.